I'm Dr. Marla Shapiro, a past president of the North American Menopause Society, and I'm joined with Dr. Vivian Brown, who is an assistant professor at the University of Toronto. And we're going to be talking about HPV. So a patient comes in and she's 20, 30, 40, and doesn't really know much about HPV other than that it's a vaccine that often is being given to school-aged children. So the question is, what does it mean for the average woman who hasn't been vaccinated, who's in her 20s or 30s? Is this a vaccine she should be considering?
I think it's a vaccine everybody should be considering because I think it's a discussion that she should have with her primary care provider. Realistically, HPV is a virus. It's very common. 75% of the adult population who have been sexually active have been exposed to HPV. That doesn't mean everybody carries HPV. A lot of us clear HPV the way we would clear a common cold. But those people with persistent HPV, persistent viral infection, are at risk for changes that could lead to cancers. So what we want to do is have the discussion with an individual woman. What is your exposure? What is your risk? Do we want to decrease your risk by getting vaccinated?
So the question that always comes up from a patient is it safe?
Yeah.
What are the potential side effects? Has this been studied long enough?
You know, Marla, I think that's a really important question because that's what patients want to know. Does something work and is it safe? Well, with the HPV vaccine, we now have over 80 million doses worldwide. It's been out for more than 10 years, so we can feel very comfortable with the safety data, whether it's the World Health Organization, the FDA, the CDC, Health Canada, all the major organizations have come out in favor of the vaccine because the safety profile is so reassuring. There's very few side effects from the vaccine, most of it local, which means your arm gets sore, and we have not seen any serious systemic generalized side effects from the vaccine.
So we've had two different vaccines on the market. The first came out as an HPV 4, Gardasil 4, and now we have Gardasil 9. What's the difference between the two vaccines?
Well, actually, there's been 3 vaccines. There's been an earlier vaccine as well, which was essentially HPV 2, and that refers to the subtypes of the virus. All these vaccines have been very efficient in terms of decreasing risk from certain subtypes, but as we've understood more, we've included more subtypes in the vaccine. So currently in North America, we're using HPV 9. It refers to 9 subtypes in the vaccine with a 90% reduction of cervical cancer risk.
So if I'm a woman who has not had the vaccine and I've had an abnormal PAP, is it too late for me to get the vaccine because I've already had an exposure?
That's a really important question. By having had an exposure, by having an abnormal PAP test, we know that you as an individual have not cleared the virus. You have persistent HPV, and it's persistent HPV that leads to disease. By immunizing you, and there's good evidence for this, we decrease your risk of a recurrence of the subtype that you have, of that cervical abnormality, but we also decrease your risk of disease in other locations. And we know that this virus can cause disease in the vagina, in the vulva, in the anal area, in men in the penis, in the head and neck or throat. So by immunizing you, even if you've already been exposed, even if you've already had cervical cancer, we decrease your risk of further cancers and we decrease your risk of recurrence of the cancer that you've had.
So one last question. What's the upper age limit that a woman can consider the HPV vaccine, even if she's in a monogamous, stable relationship? Is it something she should be considering?
I think it's something that everybody should talk about with their primary care provider. Both in the US and Canada, the vaccine was approved ages 9 to 45, and the CDC here in the US just came out with guidelines that says if you're over the age of 26, between 26 and 45, discuss it with your primary care provider. For women over the age of 45, taking the vaccine is very safe, but it's considered off-label, which means it's a decision between you and your doctor. In Canada, our National Guideline Committee says there's no upper age limit. It depends on risk.
Thank you so much.
Thank you.